afternoon to you all, our viewers. Welcome to this episode of Women Rise. My name is Madreen. Yes, exciting episode today because we are going to learn about something very, very important. Yet, little or very few of us know about this. Yeah, we're going to talk more about mental health, and in broad, we shall look at depression that new mothers go through, yes, after birth. And to discuss this or to have this conversation with, I have Miss Nassuuna Margret. She is a psychiatric clinician, and she's here to tell us about what she's doing, mental health issues, and of course mainly in women. So feel free and of course enjoy the show. Welcome, Margret.
Thank you for having me.
How are you?
I'm very fine, thank you.
How is it where you're coming from?
Good so far.
Good.
Yeah.
How is the month, the new year? How is the new year treating you so far?
Good. Can say good.
Okay.
I haven't had much challenges so far.
Yeah.
And I thank God for that.
Okay. Thank you so much for coming.
Okay.
And we are looking forward to learning more from you, from whatever you're going to share with us. Yes. So tell us more about yourself. Who is Nassuuna Margret?
Okay. Margret Nassuuna, first of all, she's a jolly person.
Okay.
Yeah, that's how I can first describe myself. I love being happy most of the time. And many people around me, I think, they've never seen me sad. I like being happy.
Okay.
Yes.
Yeah.
I love being around people. I love meeting new people, being to new places, Yeah, and everything like that. Margaret is a mother.
Oh.
A mother of two handsome sons.
Oh.
Yes. Yes, and a wife as well. Margaret is also a friend, a sister, a daughter,
She's a lot.
Yeah,
Anything to do with happiness, it's Margret.
It's Margaret.
And we are also happy to have you.
Yes.
Yeah.
On the professional side, Margret Nassuuna is a psychiatric clinical officer, fully trained from Butavika School of Psychiatric Clinical Officers, and as well as a certified counselor.
Oh.
Yes.
Okay.
And I'm this kind of person who is very passionate about mental health and everything about mental health. Just count me. I love talking more about mental health. I want the whole world, like at least now, to know what mental health is and what can they do in case something goes wrong. Like they should stop attaching it to the way we used to know. Maybe if someone gets a mental health challenge, that's witchcraft. We don't want to be there anymore. I want many people, or almost everyone, to know about mental health. Yes.
And you mentioned you want the whole world to know about these issues. Now bringing it down to Uganda, yes, from 10 to 100, I want you to scale us and at least how well do you think Ugandans know about mental health?
Okay, right now, I can say at least 50% of the whole Uganda, like the whole country, at least they know something about mental health related issues and mental health as well. Yeah, the Ministry of Health has done a very good job in creating awareness and putting up different mental health services all over the country. At least now we even have mental health services given out at the lowest level, like health center tools. At least I think we have a counselor there to handle the mental health related cases or issues.
Okay. And to someone who doesn't know what mental health is, what is mental health?
Okay. Mental health is a state of well-being where an individual can recognize their own abilities. Like me, Maggie, I can do this, I'm well at this. And they're able to cope with the normal stresses of life, and they can work productively and contribute to their community. That's how best I can describe mental health.
Okay, how long have you been, this in this, and why do you think, what motivated you to become in particular mental health specialist or a counselor, and how do you enjoy your job, of course?
Okay, first of all, I've been in this field I think now for almost 2 full years. I graduated in 2023, but I had finished way back in 2022.
Yeah.
I completed in 2022. And one of the most thing, what motivated me to be a mental health professional, back then we used to be in a community where I think people didn't know what mental health related issues are or mental health disorders are. We used to have a neighbor, I think he had bipolar. By now I know what bipolar is. He was this destructive person, over talkative. So there are people, I think they didn't know what's happening. So what they did, they tied him with ropes and took him to the witch doctor. I was like, what is really happening? Anyway, I was a child.
You didn't know,
I didn't
yeah.
go into details. But as I was growing up, going to school, I think in A level, I started to hear about Butarika. That's when I came to Kampala, basically. I used to study from Luweero, those ends of Masaka. But then when I came to town, that's at Sam Mega Memorial College, that's where I completed my A level from. I heard about Butarika. And what they were doing, like treating mental health related disorders. I went to the internet. I learned about what they meant. And what motivated me most, when we were filling the job forms, that teacher who was guiding us about the careers, where we should go. You know, I was a science, I used to do sciences. So basically everyone who does sciences, most of them want to be medical doctors. Of course, me also wanted to be a medical doctor. But then I had this aspect of mental health, and he told me, you know, there is an OG here who got a position in Butarika. So when I was filling my form, I was like, okay, let me give it a try. And I filled in Butarika School of Psychiatry Clinical Officers. That was at a diploma level. Then I was like, okay, maybe if they give me, I can try it out. I wanted to learn more. What do they do? What really affects people to be like this? What goes wrong in the brain that makes someone to be like this? I wanted to really go deeper and understand what happens in our minds to be like this. So we are there waiting for our results. Initially, I didn't know that I was given. But then some of the friends I started with in O level there in Luweero, they called me like, Maggie, we saw your name on the list of people we are given by the government. I was like, are you sure? You go and check. You know, we didn't know your index number, but you can go and check at the Ministry of Education. I went there and it was me.
It was true.
I was so excited. I was like, okay, I'm going to join this. But then, you know, before joining, I started to have mixed feelings. Should I go for this course? Should I go for nursing? You know, at that level, you get people to tell you different things. You should take this
is
route.
the best.
Yeah, you know, you can take this. So I was still there in my confusion of what to do. Then one day, I tuned to a certain radio. It's called it's Spirit FM. It's connected with ACTV.
Okay.
There was a program called John Sao. Then suddenly I landed on a psychiatric clinical officer explaining what mental health is, what are mental health disorders, how can someone behave when they have a mental problem. I was like, okay, these are the things I'm supposed to know.
These are the things I want.
If I go and join them. It was a Saturday. On Monday,
You went.
I went to the school. I went to the school and picked my admission. I paid the admission fees and everything. I was like, I'm ready to join. Then my sponsor was like, are you really going to do this course? I was like, yes, I'm going to do this course. I know many out there may not think it's the best course to do, but for me, now I think it's the best thing I've ever done to myself. And according to what I've learned so far, I appreciate. Be like, okay, a lot of people out here, they need our help, and I'm not in a wrong position. I think God just chose me to be in that position for a reason. So I appreciate to be in that position.
Wow.
For now.
Wow.
Yes.
And when you were talking, you talked about bipolar. What is bipolar? You know, many people keep saying bipolar, but we don't know what it is.
Okay, bipolar, it's a mood disorder. Yes, it's also a mood disorder, whereby if it is characterized by two forms of mood, whereby it can be a low mood or the high.
Okay.
Yes. Someone can be in a depressive phase or the manic phase. Yes, usually it's a combination. For someone to be diagnosed with bipolar, they must have had an episode of a manic phase, then a depressive episode. Yeah.
You know, I'm thinking it's very common and normal for someone to be low. But then how if I'm high or overexcited, how is it a problem that someone is too excited or
Okay, like I said, I'm a jolly person, but there is that extreme excitement. Like, it's unexplainable, whereby someone can't even explain, like, why is this person excited? In the middle of where people are sad, this person is excited. That's not normal.
yeah.
Okay. Someone can be very over talkative, they can be very aggressive, very energetic, and they tend to also have that purpose of extra self-importance, whereby someone believes they are above everyone. Yes, someone can just be like, okay, right now I can say I'm a president, but am I a president? And someone just believes me, I'm a president. You can't even change them that you're not a president. They'll just believe they're a president. Maybe for them they talk to God. Maybe, those expansive ideas. Yeah, it happens to people with bipolar. But then after having that episode of excitement, they can just go to the other extreme end where they're very sad.
Yeah.
Yeah, like they have mood changes.
Yeah, I think that's the commonest because yeah, that's very common. Yeah.
That's how simply I can describe bipolar. And we usually diagnose it after having such symptoms for at least 2 weeks.
And what are the main causes of mental health, people going into some of the things like bipolar? What do you think are the drivers to mental health issues?
Mental health issues, we can't describe like there is a certain cause, like this is it. Maybe how can you say I have malaria and there is what is causing malaria. But for mental health issues, we can't have a definite cause, but they're just factors that can predispose someone to certain illnesses. For example, I'll use that of bipolar, okay, maybe depression. Sometimes just genetic is their line, like maybe someone in their family had bipolar. So, if you are in the next generation, you are predisposed to have bipolar. Sometimes there are just these other factors around. Maybe, for example, I can say if someone suddenly lose their job, their brain can just change suddenly. They can first go into depression, maybe later they change and get the other extreme end of bipolar, get the manic episode, something like that. Sometimes people can just get that, for example, after birth. It can be just after a certain disaster, like sudden. For example, if we have should I say floods, if they come and damage almost everything, like something that is sudden, it happened, wasn't expected, then like people react differently to certain situations. Then it can predispose or cause someone to start having a mental health issue.
And I know this is January, end of January, people are taking kids back to school. So what do you think is the mental health? How is the mental health, currently? Parents.
There is a lot of stress.
I know.
And a lot of stress can cause you to get depression. It can lead you to get depression if you can't handle certain things. You don't have the best coping mechanisms. You don't have support. You can end up there.
Okay, as a mental health professional, what are some of your career goals, you as an individual?
Me, right now I'm looking at giving the best compassionate care to my clients or people having mental health challenges, like to make a real difference in their lives. Right now I'm dedicated to redefining my skills to give the best care to them. And then in long term, I want to contribute to improving like mental health care services and access to the services. For example, I want to be part of a movement that makes mental health care services more accessible, create more awareness about mental health, and then also reduce the stigma towards seeking mental health care. Many people fear to come and talk about, express how they feel because they fear of being judged. Some people, for example, men, they think, oh, it's normal, it's known that men are strong. But everyone is a candidate of a mental health related issue. Anything can happen. For example, loss of a loved one can predispose someone to get into depression. For example, like totally everyone is a candidate. It's just that we can manage because of our resilience, because of our coping mechanisms, because of support. But everyone is a candidate.
And you talked about the stigma. Is it only to the the patients, but also the community around? Just your neighbor hearing you're receiving treatment from Butavika. Just the name Butavika alone is something so big. So the community, how should the community receive these patients and also offer support to people with mental health issues?
I think by that we need to create more awareness in the community. We need to have more programs whereby we can talk about mental illness and people know what it is, who can be affected. Like they should know everyone is a candidate. It can happen to anyone. They should see it as a normal thing, like how people can know, there is cancer and anyone can get cancer. I want people to start to see mental health issues as that. And they should stop this thing of isolating people with mental health illnesses. Like they do not choose the life they are living, and anyone can get to that level. They should actually learn that it can happen to anyone and receive these people with empathy, instead support them. It should even actually start with the people, the closest people, like the family. That's why when we are treating our clients, we need family involvement. We want to tell them, to educate them what is happening in their relative's life. We want to tell you that this is happening because of this. How can you handle this? It is really hard for people to receive the news about their client or their relative that is facing this. But yes, you have to embrace it. You have to learn. You have to know what is happening and how can we best support this person instead of isolating them. Back then, people used to hide these people.
Yeah, true. Away from,
and you'd be like, is this also their relative? They don't even want people to know that this person exists, which is really wrong. It's even against their right as the people suffering from a mental illness. Yes.
So Margaret, how can one tell that my mental health is really not stable, or even the people around you? How can these people tell? What are the quickest signs that can indicate that someone is depressed? I think the commonest thing that affects us all is depression. And many of us don't even know what depression is. What are the quickest signs and symptoms?
Okay, first of all, I'll bring it in this perspective. Like, for someone to be diagnosed with a mental disorder or a mental illness, it means they have that health issue that significantly affected their emotional, their cognitive and their behavior aspect of life, whereby we're going to see a disturbance in these three, the emotional, the cognitive and the behavior, whereby in the behavior aspect you'll start to see this person who was a jolly person who loves people starts to isolate themselves. Even at work, you see your colleague no longer wants to be around you. You'll be like, but what's going on? There are those changes. Then someone will start to see the changes in their sleep. Some may be oversleeping, others may not even get any sleep.
Even oversleeping.
Yes, oversleeping can also be a problem. Actually, more in depression, if someone starts to oversleep, that can be a symptom. Then also you may
It's okay because
Can I
yes,
can I
because we
explain
also
that?
have viewers here. We can mix the two. Yes.
Okay.
Yeah.
Someone wakes up after having some good sleep, but they feel like they are weak. They don't have energy. Be like, but I've had enough sleep, but I feel like so weak. I can't even get
And
out
you've
of bed.
eaten.
Exactly.
You've eaten, but you're not feeling yourself.
Yes. Then in the emotional side, if someone starts to feel excessively sad, sometimes teary,
Oh.
and it happens almost all the time or every day. Then you start to question. Someone was a jolly person like Margaret,
Yeah.
and suddenly she's crying almost every day. Be like, but what's happening? That can be an indicator that maybe something is going on in their lives. Yes. Some people may start to feel nervous all of a sudden, extremely worried all the time. Someone always in fear without a clear reason. Okay, when those people have anxiety. Sometimes someone is restless. He comes to work, doesn't sit down, moves up and down, moves up and down.
Yeah.
We start to be like, what's the problem? So there are many symptoms.
Now you talk about being restless. Just some time back, my mom was really sick, but I even failed to concentrate. You go sit down, you feel like no, this is not moving on, this is not working. You try something else, and nothing is really adding up. Oh.
Yeah, then there are these people who become extremely happy, excited over unexplainable reason. They become so talkative, destructive. Some people even wander away from home, and they find themselves in another city without even knowing where they are. Like someone has really detached from themselves, from
Their
the
family.
environment and everything. Some people start to hear voices, others do not hear.
Yeah. Margaret, what does it take to convince someone that you have a problem, you have a mental health issue? Because like I said, I was depressed at once, but did I even get medication for that? No. So, and I've also seen cases where families are trying very much to convince this person, you're sick, maybe let's try somewhere else. And the person is, no, I'm not sick, I'm okay. What does it take, to convince someone, that, you need mental health, something, help and guidance?
Some people don't want, they always live in denial. They don't want, some people have this perspective, I don't want to be a burden to people.
Yeah.
So even when they are not okay, they don't believe they are okay. But with the help of a mental health professional, we can come and talk to this person, encourage, educate them about what is happening, and eventually they can accept that really, according to what I've had, I really need help. Sometimes, according to the severity of the condition, some people don't even need assurance or convincing. Some people are just picked by those people who love them, sometimes encourage them and bring them to get care. Some people are going to live in denial. For example, some people who have psychosis, they will not believe. They are so detached from the reality to the extent that they cannot know what is happening. It takes some time for someone to get insight into what is happening. So it depends on the severity of the symptom or the condition. If someone is at this level, you can convince them, talk to them and be like, you see, this is happening, this changed, but don't you think we need to talk to someone about it? It takes a lot of courage, patience
and support.
To get the best outcome for them.
Now we are nearing the biggest conversation of this women, mental health in women. And the biggest issue that we want to focus on today is the depression for a new mother, before even you get pregnant, someone who wants to get pregnant, what are the issues that come with it? And then someone is pregnant, that there's also that period, and then after birth, you know, it is also something else, totally else. Yes, we want to look at this depression amongst women during, before, and also after childbirth. Yes, what do you think triggers this postpartum depression, and what is postpartum depression?
Okay, postpartum depression. This is a mood disorder that happens in mothers after giving birth. It's like mood changes that happens in a woman's life, or a new mother after giving birth. It can be uh, characterized by some of the signs and symptoms. Okay, how someone can know that maybe this person has postpartum depression. This new mother may begin to be irritable most of the time. They may have mood swings. They may be excessively sad most of the time. They may start to withdraw themselves. They want to be alone. Sometimes they don't want even to be next to their children. Like they really don't want anything to do with their children. And be like, okay, I expected a mother to love their child, but when someone has postpartum depression, they don't even have that love for their children. Some of them, it's a lot that can go on in their lives. That can be from a few symptoms to the severe symptoms. For example, a mother may reach a point whereby they don't want to associate with anyone around home. You get for them someone to help them at home, they don't want anyone to be at their home. They are so rough, sometimes they can be aggressive, they start not to sleep. They can either sleep too much and ignore the rest of the things, or do not sleep. So those are some of the things I can bring up to show if someone has postpartum depression.
And maybe before postpartum depression, I want us to talk about this, you know, before someone gets pregnant, and then maybe during the process. Yes, you're pregnant, but then the mental health of women that go through, they go through this. Yes, how can one, you know, realize, you know, someone is depressed as a mother or as a woman?
Okay, like those same like symptoms and signs I've talked about, still the mother will be like, they do not want to. Okay, if someone has just gotten pregnant, there are a lot of changes that go on in the mother's life, or the body changes, you know, the body changes, the hormonal changes, so that they can sustain the baby. A lot of things go on. So this mother may start to be excessively sad suddenly. You will never see this mother happy. Be like, we expected this mother to be happy, but you know, it's as if she doesn't. She will not be herself. She will be irritable. She will have the mood swings. She will start to isolate herself from others, even if it's the husband or what. Like, she will start to behave in a certain way, like she doesn't want to associate with anyone. Yes. Some people may even reach an extent of having suicidal wishes, or even ending their life, or even harming others in that way. Some may start to have the poor coping mechanisms. Some people may start to take alcohol. You know, depression makes you to start to do those high-risk behaviors.
Things,
Trying to kill yourself, take excessive alcohol. Those are the things you can't see and be like, this person is not okay. She's always crying. She's never happy. She's always sad, angry. Most of the time you'll be like, okay. Like, there is a certain research I did still in pregnant mothers recently, and I got to realize like most of them were depressed. However, they had the courage to still come for antenatal care, which was really a good thing. But then out of the results, we recognized that at least over 50% of the mothers we encountered, they had some percentage of depression. Yes, and we went further to know what could be the reason. We looked at, most of I think it was about lack of support from partners. Some people they had unwanted pregnancies, financial strains, a lot of things were going on.
Now you mentioned about antenatal care. You know, with these women, do you offer, you know, counseling services to these women?
Yeah, but right now, just that I'm not in that setting of maybe the mother and child department, I'm not in that field, but at our center, we offer such services if a person comes in that way. We give individualized care according to the way a person comes. If we have a pregnant mother, so we give a different kind of package because we know what happens. We have that mental health screening about depression in pregnant mothers. We do all screening, mental health screening. Yeah, so that at the end of the day, we know what could be the problem and handle depending on the situation. But now I think I realized there is still lack of mental health screening during antenatal care.
Yeah.
Because when we did research, we did that research in Kawempe Women's Hospital. We try to interact with the mothers around, and I think they have had this depression because we got those who were in that third trimester, second, and I think these issues were not managed. So the good thing, we left after connecting them to care, and I think now they're doing well. Right now, I think they should take it as a point to do mental screening during antenatal so that they can reduce on the occurrences of postpartum depression, because if you have had depression during pregnancy, there are chances you will get it
after birth.
Yes.
Okay, so we look at postpartum care after birth. Which kind of care do these mothers need? Because someone, you know, you tell someone you're depressed, or after giving birth someone needs this kind of care. Many of us don't even believe what you're talking about, you know, after giving birth. Yeah, what really happens, you know, for a new mother? You don't even know what is taking place, what is going to take place. You don't know how to handle a baby. What really happens there after, you know, after birth?
Okay.
Connecting it to the mental health, you know, of a woman, of mainly a new mother.
In a new mother. I'll give it in my own perspective. When I was a new mother, you know, getting pregnant for the first time, you don't know what is going to happen to you. Okay, you know a woman gets pregnant and gives birth, but you don't know what is happening. You're going to have this anxiety first. Okay, I'm pregnant, but now what happens? But you know, even the body, God created us in a way that a lot of things are going to happen. Body changes, our uterus will enlarge, our breasts will grow bigger so that they can have enough milk for the baby. Even our hormones change, our brain chemistry changes. Like, there are going to be a lot of changes. But many people don't know that, and they are not educated about it. So what mothers should know, or what people should do to best care for the new mothers, is they should first know what happens in a woman's body after giving birth. First of all, there are going to be hormonal changes. We have these female hormones, the estrogen and the progesterone, when they are high during pregnancy. But now when you give birth, they're also going to do what? To go down. And when they go down, they affect our mood. And eventually, you know, it can be a cause of what? Depression. But how can you best care for a mother after this has happened? Other physical changes are going to happen. The pain you're going to get after giving birth. You know, some get hemorrhoids after giving birth. Some get pain in that birth canal. You know, anyone who has ever given birth, they know this experience. Some have had a very traumatic birth experience. For example, a first-time mom has gone into a delayed labor. She has experienced all the pain to the extreme. Some have been induced. For me, my experience on my first baby, I was induced. I was like, okay, this pain, I've never seen it. I've never seen it.
I don't want to tell you my experience.
I think that is the hardest thing that has ever happened in my life. So, you know, this thing can predispose a woman to these mood changes. You still have that fear, you still have that trauma in you.
You know what I did? It's so funny, but my daughter, Actually, I think I failed to push. You know, the cervix wasn't opening, stopped at 2 point something. But then, so they decide to induce me. I was already tired. I said I want to go for a C-section, which. And then they said, no, let us first try. They induced me. The pain was not bearable. So what I did, when the doctor moved away, I got that bottle, and I would just empty. I got a bucket and started emptying it because it was too much. I was already fed up. Everything was so painful. I don't know. Yeah,
so
it was really funny, but
it was really painful. I can really imagine. I can relate. I went through the same process with you. Maybe they would tell me, you stay on the bed, it's going to be okay. The good thing, I had support of my sisters and my husband. That was the most encouraging thing.
Yeah.
Okay, my sisters had experience with giving birth, so I was the only new person. They would be like, hey, Margaret, it's going to be okay, calm down. But I was like, I couldn't even be on this bed. It was really so traumatizing, so painful. So this is the thing I want to bring. Like, mothers go through a lot.
And when you're getting pregnant, no one will tell you that, when you're pregnant, this and this happens. Everyone is, as because we all want to have children. So the moment you get pregnant, there is that joy. So everyone you see on social media, let me say, posting about their pregnancy journeys, it's all the happy times. You're enjoying your belly, but the dark sides behind the closed doors.
They may not
For
tell.
a new mother, it's really.
But sometimes it's okay to bring out your experience, and mothers they're not the ones who have experienced this. There's a way to give them courage to embrace their healing journey. For example, if a new mother who has gone through the same experience you went through, if she sees us right now, she will know that, okay, this happens, does not happen to me. So let's go back to the other point. A lot of things happen in our lives as we give birth. Then there is another world we have gone into, having this new person in our life, like in our world.
The new person also comes with their own issues.
Exactly. You reach a point whereby you don't sleep. You have to attend to this person. But now you're also exhausted. You want to sleep. Those are some of the things that can predispose a mother to get postpartum depression if she's not supported. Me, I remember, I think I was so exhausted. I reached a point that I couldn't even hear my child crying. I was so deep in my sleep. They could wake me up, Margaret, you wake up and breastfeed the baby. I couldn't hear because I was so exhausted. Like, there's a lot of physical exhaustion, sleep deprivation that comes with giving birth. So how can we best care for these mothers amidst all these challenges, the traumatic birth experience? Sometimes mothers give birth to children with special needs. That is also another issue. But how do you support mothers? That's the issue. First of all, we should support mothers physically, emotionally, like every aspect of life. Mothers need to be supported at least for the first 3 months after giving birth. Mothers should be supported either by family, close person, and the more so our partners.
Your partner
should be part of this. And I think I would appreciate if our partners or the family is educated about what happens after giving birth. The changes that are going to happen. Okay, if a father or husband knows, okay, there are certain changes, like hormonal changes that are going to happen in my wife's life after giving birth. If he sees you with your mood swings,
he should be able to understand.
Be like, okay, I think she's going through this, and they support you. You have to sit down and listen to these mothers, validate how they feel, their experiences. Some people tend to be like, okay, you're a third-time mother, you're a veteran, you're what? I want to tell you, we all have different birth experiences at different times. I may have a good birth experience on my first baby, but then the third baby comes with maybe postpartum hemorrhage, a lot of complication, and now you're just telling someone, no, it is okay for you, you can handle, you're a third-time mother, you're a veteran. No, we need to listen to to these people and validate their feelings, how they feel, the pain. There is a lot of pain even after giving birth.
And
it takes time
Margaret,
to heal.
before even before you go any further, I'm now thinking, where does this depression start from after birth? Where does it start from? Because
I'm
immediately
trying to bring in the things that change that can lead to depression.
Yeah.
The hormonal changes can contribute. If the mother had antepartum depression, or maybe has a history of depression in her life.
What is antepartum depression?
That's
now?
depression during pregnancy.
Okay.
Or maybe depression before. That's having history of depression before getting
so
pregnant.
it still come back.
Yes, it predisposes you to that. Some people, it can be because a traumatic birth experience. I've had my pain. I feel like, this is too much. Having special needs children, that can also contribute. Having those complications. Someone has had postpartum hemorrhage. Someone was operated. Some people be like, I've had a C-section. That is also traumatizing.
Yeah.
It gives you some kind of different anxiety. Like, you didn't expect this, but it has happened. It's not going to leave someone the same. Because I want to bring in certain things that can bring this. Lack of support.
Yeah.
Someone has given birth, but even the father denied the pregnancy. She's going through a lot. There is no financial support. Someone abandoned them, like, me, I don't want to know anything about you and the child. It's not easy. Unwanted pregnancies. Someone got pregnant, she didn't want it. Even now having this baby, they don't want to know. Those are some of the things that can predispose someone to getting postpartum depression. Even the major life changes. Someone has lost a job after giving birth. They don't expect any form of security. Like, now they are on their own. Like, even other changes. You've lost a mother. You've lost a closest partner after giving birth. A lot of changes that can happen and contribute to someone getting postpartum depression. But now, let's go back on how we can best support these mothers. First of all, after all those body changes, the hormonal changes, everything that has happened in the mother's life, first of all, you have to give them time. Listen to them, validate about how they feel, the pain. Reassure them, encourage them. Even having someone who is experienced, talking to them can make you calm down. They can tell you, this happens, and okay, this pain is expected to be there. As a first-time mother, you didn't know you're going to have these changes. You didn't know that maybe you're going to have this, there is something they call episiotomy. Some of us didn't know, but it happens. They suture you and be like, oh, this is also there. But even the wound care, if someone supports you and tells you you should do this so that you can heal, it makes your recovery journey as a new mother very easy. We should also encourage them to express about how they feel. Because if a mother expresses about how they feel, you will know what is disturbing them. So if it needs attention from a healthcare provider, you will know and at least help them seek this medical help. But if there are these people who have to be strong on themselves when they are not even strong, like, you don't give them that space, safe space for them to express their emotions. That's not really good. We need to have to be there for them. We need to help them take care of that baby. After giving birth, you're tired as a person, but there is also this human being you have to take care of. But if you have someone to help you,
and
maybe
you're a new mother,
baby,
and most times you don't even know how to hold a baby.
You don't even know how to breastfeed. Me personally, I didn't know. I had to learn from the antenatal care classes. Then even my sister telling me, you have to hold this breast like this. I was like,
it now explains why, me where I come from, after birth, at least you take some time off, you go to your mother's place, for at least a week or 2 weeks. Be with someone who has been there, for all that.
They help you make the food, like prepare food. Like, you don't have to be everyone. They say mothers, we carry everything on our shoulders. But you also have a life. You have to take time.
And Margaret, now you're talking about the people around, this new mother. how about this very new mother, you personal as a new mother, what should I do as a person to see that, after birth, my mental health still stays stable? Yes, because at one time, I don't know, is it last year or the other year, just TikTok videos. I don't know if it was the cause of what, but then from rumors or comments of people, this lady died just after, I think, weeks after giving birth. But then they say it was C-section, but then some comments, people were commenting, she was always on phone. Yeah, so I want you as an individual, you as the new mother, yet what are some of the things you can do for yourself? What should a new mother know that I should do this as a person, for my mental health well-being?
Okay. As a new mother, first of all, you need to take care of yourself. Prioritize self-care.
Yeah, before other people come in, even, yeah.
Prioritize yourself as well as the baby. As much as you prioritize your baby, is the same way you should do yourself. That's why I encourage extra support, so that if others are helping you with the house chores,
you have time for yourself.
You have time for yourself. When the baby sleeps, you sleep. Now this one has to go hand in hand. Just tell me the baby has slept, why don't you sleep? I'd be like, okay, because there is a time when this person is going to be up and you're going to be on your legs like
and
this.
late in the night.
Exactly. There is also that period of colic pains. They will cry for you. But if we didn't take the other time to have some sleep, you're going to then get this exhaustion from sleep deprivation, because you didn't sleep when the baby was sleeping, and now you're up together. For him, he'll take some time after and sleep for you when you feel so exhausted, frustrated. This is going to contribute to a lot of stress in your body, and eventually you get depressed. But if you prioritize your sleep, instead of being on your phone, take some time and sleep. In fact, it's not even encouraged to be on the phone, especially in the first 24 hours. At least one day, give yourself a break. And if you're going to be on your phone the rest of the days, have some time. Be like, okay. But during that time, it's you to rest, not even, at least at work, they gave you a leave. They're helping you with the house chores. This is time for yourself. Take some time off. Go do some yoga. If you've healed, you can do some yoga. You can meditate. Take some time off to care for your mental health before you get this frustration and burnout from taking care of your baby. Yes.
Because I've also seen, new mothers, hating their babies.
Okay, that's where it comes in. It's either depression. If it's after 4 months, that then we start to query, is there some kind of psychosis?
Okay. What is psychosis? Oh,
Okay.
oh, these are science terms, and some of us who are not scientists, so we have to ask, what is psychosis?
Okay, psychosis. It's also a mental disorder which is characterized by detachment from reality. Either yourself, the environment around you. So by the time a mother starts to hate that child, she may be not even seeing her or him as a child. She may be seeing something else. She may be having a voice telling her, oh, but this one is what? This is a threat to you. She's detached. It can be because of depression, but they can also be psychotic depression.
Because I was watching a documentary of, depression mothers go through, and a woman said, she killed the baby.
That could have been
And she also,
psychosis.
Committed suicide.
That could have been postpartum psychosis. That's where someone really detaches from everything.
And you find you have no reason, to live.
Yes, someone even, and after killing the baby, then you may get back to your senses shortly and be like, I've committed an offense. After, for you, in a way of taking accountability for what has happened, you end up of doing what? Because the community is going to judge you. You may fail to take it in. You may fail to give up yourself and be like, oh, okay, I've committed this. If we do an assessment, I'll be like, it was under influence of a mental illness, then it can be, but she may fail to take it in. That's why sometimes they
also end up killing themselves.
But with proper support, they can stay and then know what was happening. During our management, we have that point where we have to educate the person what is going on, and they finally, after some time, they gain insight. Because for example, someone has psychosis, they can't even accept to take medicine. For what? They know they are not sick. They know, they just have
denial.
they just have a different kind of environment. They understand. They may not even know their name. They may not even know where they are, who they are, people around. Like, they may not know anything. Just like those people you may see moving on the road, carrying rubbish. They may be in a different kind of environment. They do not even understand what's happening. That's how I can best define psychosis.
Oh. Wow, this is amazing. We need to know this about such issues, because a lot of people don't know even, So now, in a nutshell, in a summary form, what should a new mother mainly, you want to be a new mother, what should they look out for? What should they expect? Yeah, in regard to, keeping your mental health in good shape.
Okay. New mother. Okay, people are expecting to be mothers. I would recommend, if someone is preparing to get pregnant, not really having sudden pregnancy that happens sometime. If someone is really prepared to get pregnant, they should seek for, I think, pregnancy counseling. Why? I think this thing is going to give you a broader view
of what happens in the whole process. Preparing your mind is very important.
It will be good, just that some people don't have that opportunity, but it would be a very good thing, whereby they even advise, they tell you what to do, or maybe you can go to a gynecologist. They will tell you, because there is this thing where moms miss the importance of taking folic acid in the first trimester, which is very essential for the brain development of a child. That's why we see some mothers have children with with what? Brain development disorders, like children with special needs. And if they get that chance of being educated, what should be done would be more important. And I think even having workshops, like as midwives or people in that field, and they teach people about these things. What is the importance of doing this? What is the importance of going for antenatal care? There are a lot of things that are going to happen there that an individual will not know. At least, even if, okay, you've had an unwanted pregnancy, go for antenatal care. It is very essential. It will help you navigate most of the things, know what to do, what is happening to your baby, what should be done, how you are. At least now, I think they have embraced the thing of even talking about mental health. I would appreciate if the child and maternal health field incorporate this mental health in their services. Because mothers need it the most, so that they can prevent further outcomes like postpartum depression. Because if you recognize that a mother is going through something, she has depression during antenatal, you will handle that so that it doesn't come after giving birth. That's one of the things I would appreciate mothers to do. And another thing, to join support groups. If people who are planning to be mothers, there are those support groups where people go and share experiences. What happened? How did they cope? How did they manage this?
I've seen this, in the white countries. People really do where the two partners go, and then there's, I don't know what they do, but there's someone teaching them how to. Do we have this?
Yes.
Maybe the services here in Uganda are limited, or
they are limited,
and we don't even know where to find them.
Yeah, but I would say if someone is planning to get pregnant, these services are there in those gynecology departments, or child and maternal departments, women's hospital. Those services are there. All women's hospitals offer these services. Then if you just want to make your consultation about anything, they are there. If you fail to go there, you can approach any mental health. a health provider, they can direct you on where to go. At least I know they are there.
Wow. Wow.
Mulago, I can recommend the Mulago Women's Specialized Hospital. I can recommend the Mary Stops. There are also these other people who are passionate about maternal health.
Yeah.
I've heard of who is it, Dora Mwima. She has some support groups for women who are pregnant. Yeah, you can reach out and see how you can best help than just sitting there now not getting a solution. Yeah, the services are there, just that we do not have clear information.
Yeah, true.
And by the if you go on internet and you just put in what you want, they will bring in some information that can help you navigate on what you want to find.
Yeah. Wow, thank you so much, Margaret. Now, as we wrap up, yes, our conversation, thank you, of course, for, this is very important. I know, I've enjoyed the show. And so as we wrap up, how do you do your counseling, mother and then mental health? How do you juggle through all these?
Okay. Me, I would say I have boundaries. I would say boundaries. It's good to set boundaries as a working mom.
Yeah.
Because, we're not going to do one thing. We're in a world where everyone is working.
Yes.
If you really don't have that one thing that stops you from working, you'll go and work. And this person is passionate about what I do. I want making a difference in people's life. I want to instill hope and healing in people who are dealing with mental health challenges. So I just do my boundaries.
Your boundaries.
And be like, okay, Monday to Friday, 9 to 4. That's my work schedule.
Yeah.
Beyond that, or before that, it's me time and my family.
And your family.
Yes.
Wow. I think that is also important because connecting it to our mental health, we need, to set boundaries for whatever you have to do in a particular time.
Don't be this person who carries your work
to home. Yeah.
You're going to be burned out. You're going to be frustrated. You reach a point where you're not productive because you're dealing with a burnout.
Yeah.
And you may not even realize it. It's only people at work who be like, you see, but Madreen is no longer performing. She's no longer coming.
Yeah, something is
off. Something is off.
Yeah.
That's why someone can know, but something is not going on well with my mental health. So it's good to draw your boundaries and be like, okay, it's 9 to 4, it's work time, and you make sure you prioritize your tasks within that time. You have your to-do list in the morning and be like, today I'm doing this and this. It's going to be easy for you and be like, what am I supposed to do at this time? So if you practice that, it makes work easy for you. Now for us, sometimes we work on appointments. For example, at Inner Spark, we even offer those counseling sessions online. We offer trainings to different organizations about mental health related issues. But we schedule and be like, today we are going to this organization. Today I have this client, an individual person, like it's gonna be an individual counseling session. You just have your schedule and be like, today I'm seeing this person at this time. It's going to give you time to do what you're supposed to do in time, then later you have your own time. Yes.
Wow, thank you so much for educating us. For this is awareness, community awareness about mental health. This is important. Thank you so much. I believe someone there has picked something. And maybe lastly, if someone wants your services, someone has enjoyed the show and they would wish to, you mentioned you're a counselor. Yes, where do they find you?
Okay. I'm based at 2 rehabilitation centers, as well as Inner Spark Recovery. They can find me at Mteri Medical and Rehabilitation Center, but as well I can share my contact if it's fine.
Yeah, it's okay.
Yes, it is 0750 911 306. You can reach out on that contact, either WhatsApp or call. Then you book your appointment, and we navigate this recovery journey together. I want everyone this 2025 to prioritize their mental health than ever before. Yes. And everything starts with mental health. Everything starts with mental health. I repeat, if you are okay mentally,
everything will move smoothly.
everything will be okay.
Yeah.
To even help you cope with what comes your way. It's going to make you more resilient and handle certain issues that come your way. And lastly, I want to encourage people, like, it is okay to seek for mental health support. And having a mental illness doesn't define you. It doesn't define you to be weak.
Yeah.
Opening up about what is happening in your life, it is a sign of strength. And seeking for support, it is a sign of strength. And having a mental illness doesn't mean it's the end of it all. Like, you cannot do anything.
There's still life after recovery.
There is life after recovery. You can live as any other person when your illness is well managed. There is treatment for postpartum depression. There is treatment for psychosis. There is treatment for bipolar. Like, each and every disorder has its own treatment.
Yeah.
And the earlier the intervention, the better the outcomes. So don't sit out there and be like, this is the end of it all. If you feel like you fear opening up to anyone else, as professionals, we are here to support you. Reach out to us. Make a consultation. The consultations will be free. At least you will know, we navigate this thing together, and you know what your problem is, what is challenging you, and eventually we can find a solution together.
Wow.
Yes.
Okay, thank you so much, Margret.
I remain Margret Nassuuna, and mental health is my priority.
Of course, yes. Thank you so much to our viewers. And so we've had a very wonderful session about mental health and depression amongst women. Yes. So if Margret has given you her contact in case you've loved the show, because she cannot share everything here, yes, because of time and so on. You can give her a call, of course, only if you're a serious patient, a serious client. Give her a call, and she talks to you. She has said, speaking up, talk about what you're going through so that people know where to start from. Yes, thank you so much. And if you are a new viewer, you're welcome to Civic Space TV. Please follow us and subscribe to the channel. Follow all our conversations from Monday to Sunday. You can also follow our conversations always on Twitter, X. Yes, we are always there. Facebook, Instagram. Like the channel, and of course share this link with other women, your fellow women, because there is a lot to learn from and a lot to pick from. Yes, we want to make mental health known to everyone. So by you sharing this very link, you'll be helping a soul out there who is lost somewhere and they don't know what they are. Thank you to the people behind the cameras. Been Madreen, your host. See you next week. Bye.